Good morning, my name is Delora Beach. I'm a nurse here at Choices Clinic and the clinic manager. Today we're going to give you some information and education on STI education. We have some information that we think will be helpful for you and some things that you would need to know in your health class. So the first thing that we're going to talk about today is the three different categories of STIs, also referred to as STDs. STI stands for sexually transmitted infection. STD stands for sexually transmitted disease. So there are three different categories. The first category is bacterial. This type of infection can be treated with antibiotics and cured. The second category is viral. This type of infection, although cannot be cured with medication, the symptoms can be treated. And the third category is parasitic. This type of infection can be treated with antibiotics. The first type of STI or STD that we want to talk about today is chlamydia. With men, there's usually no symptoms. Some experience a discharge from the penis or burning with urination. With women, it's called the silent disease because women usually do not experience any symptoms. Those that do usually experience pain or vaginal discharge. Damage from chlamydia can cause infertility in men, and with women, it is considered to be the most common cause of infertility. Advanced stages may cause permanent damage to the uterus, fallopian tube, and ovaries, and it can also lead to pelvic inflammatory disease. There's an estimated 2.86 million new cases annually. Most people are unaware of infections, and repeat infections with chlamydia is common. With chlamydia, this is caused by bacteria, so it can be treated with an antibiotic and cured. The second type that we're going to talk about today is gonorrhea. Gonorrhea for men usually only causes some burning with urination or sometimes a discharge. With women, if symptoms occur at all, they include pelvic pain, painful urination, and a discharge. The damage from gonorrhea in men can lead to infertility, scarring of the urethra and urinary tract. With women, it can lead to infertility, surgery in severe cases, which it is also a common cause of pelvic inflammatory disease. If it's left untreated, it can increase a person's risk of acquiring HIV. There's an estimated 820,000 new cases annually. Most people are not aware that they're infected in the early stages. Gonorrhea can be treated and cured with an antibiotic because it is in the bacterial category. The third type that we're going to talk about today is syphilis. With men, they can experience a non-painful swollen ulcer on the external genitalia. Sometimes they have changes of skin, fever, and an enlarged lymph nodes. In women, they don't usually have any symptoms in the first stage, and the second stage, their symptoms can be same as the men experience. The damage for men can lead to brain disorders, heart disease, blindness, dementia, and death. With women, the symptoms or damage are the same. It can cause birth defects or death in newborns if the mother is infected. It can increase the risk of HIV infection. Annually, there are about 115,045 new cases reported in the United States. Many people have no symptoms for years until late stages. But syphilis is a bacterial infection and can be treated and cured with antibiotics. The fourth type that we're going to talk about today is HIV or AIDS. With men, it's usually symptoms of fever, sore throat, fatigue, swollen lymph glands, and people have to be tested because symptoms mimic other diseases. With women, it's the same as men. It can cause immune system breakdown or death, and the women, same as men. There are 38,739 new cases in the U.S. alone, and 1.1 million people in the United States living with HIV. Worldwide, there are 32 million people that have died and 37.9 million living with HIV. HIV is a virus, and although there are a lot of treatment options now available, it cannot be cured. The fifth type that we're going to talk about today is genital herpes. Lesions appear at the site of infection with periodic eruptions of painful blisters and ulcers anywhere on the body. These symptoms are present in both men and women. There are continuous outbreaks, eventually leading to possible hospitalization, and lifetime medication is required. With women, sometimes the herpes virus infection during pregnancy and delivery can have very serious effects on newborns. There are about 16% of U.S. women infected, with 776,000 new cases annually. 87% of people infected with genital herpes are unaware that they're infected, and about 1 in 8 people ages 14 to 49 have this infection. Genital herpes is actually caused by a virus, and although that cannot be cured, there are medications available to help treat the symptoms. The sixth one that we're going to talk about today is HPV, or humanopapillomavirus. It can cause wart-like growths on men in the genitalia area as well as women. Often there are no visible symptoms. Some women experience vulvar bleeding, itching, and pain, abnormal pap smears. Women initially have pre-malignant changes, so sometimes it's hard to diagnose because the actual wart-like lesions are not visible, and it's only detected at times through a pap smear. And that can actually lead to cervical cancer in women if it's left untreated. And for men, it can cause cancer of the penis and the anus. About 79 million people are currently infected. 14 million people become newly infected each year, and it can lead to cervical and other cancers. While HPV is caused by a virus and cannot be treated or cured, there are some different types of vaccines available called Gardasil. The seventh type that we're going to talk about today is Trichomoniasis. Trichomoniasis is actually a parasitic infection. It's the only STI or STD that we know of that is caused by a parasite. Most men do not have symptoms. Some may have irritation or discharge or burning with urination. Women can have a vaginal discharge that can be discolored and have a strong odor. With men, it can lead to bladder and prostate damage. Women, it can cause genital inflammation, increasing the woman's susceptibility to HIV infection if she is exposed to the HIV virus. It also increases the chance that an HIV-infected woman can pass HIV to her sex partner. There are estimated 3.7 million cases in the U.S. It is the most common curable STD in young sexually active women, and it can be treated and cured with an antibiotic. And lastly, we're going to talk about pelvic inflammatory disease. This disease only affects women. Because some of the STIs that we talked about earlier can lead to pelvic inflammatory disease, such as chlamydia and gonorrhea, symptoms are minor and they're mistaken for menstrual cramps. Chlamydia and gonorrhea can lead to pelvic inflammatory disease. It can cause scarring from infection, and it increases the risk of ectopic pregnancies by 6 times. It also increases the risk of infertility from 8% all the way to 40%. And it also causes chronic pelvic pain. Untreated STDs can cause pelvic inflammatory disease. 1 in 8 women with a history of pelvic inflammatory disease experience difficulties getting pregnant. So now we're going to talk about your sexual exposure. The thing that is important for you to remember is that just because you have had one partner or 2 partners maybe, that does not mean that your exposure is limited to that one person or that second person. When we're talking about sexually transmitted infections or sexually transmitted diseases, those numbers are exponential. So we're going to talk about that real quick and some statistics from a brochure called Your Sexual Exposure. So normally what we find is one person has 1 exposure. If you've had 2 partners, your exposure would be 3. If you've had 3 partners, your exposure would be 7. If you've had 4 partners, your exposure would be 15. 5 partners, your exposure is 31. 6 partners, your exposure is 63. 7 partners, your exposure is 127. 8 partners, your exposure is 255. 9 partners, your exposure is 511. And 10 partners, your exposure is 1,023. those numbers look a lot different when we're looking at that brochure. So we're here to remind you the importance of educating yourself on your choices, and the information that we've given you today we hope that you find helpful.